This video is a general video about rhinoplasty and chin augmentation. It's a patient experience video because we actually include some files of her first week post-operatively, so you can get a kind of a sense of what she went through, how she was feeling in her first week during surgery. I'll kind of review the surgical plan along with the intraoperative portion of the surgery, and of course we'll look at some before and afters from her surgery. Okay, so this is our patient. She's a very nice young lady. She had concerns over her dorsal nasal bump, little bump on the bridge of the nose, and also she felt that her chin was a little weak in the side profile, so she wanted an enhanced profile and reduction of the dorsal bump. From the front, you can see she has a little bit of bump here. We'll see more on the side profile, and again, you really can't see projection from the front view. When you turn to the side, you see a little bit of a dorsal bump here, and you also see the chin contour starting to come in. And from the profile, you can get the full effect. Dorsal bump, a little bit of recession to the chin. So the plan, in her case, was to do a rhinoplasty and a chin implant, removing the bump, strengthening the chin. So with her case in mind, we selected a chin implant based on some preoperative morphing to kind of see what sort of projection in the chin she would like, along with the reduction in the nasal bump. This next photo is her on table before surgery, kind of pre-op shot. You can see, of course, the intertracheal tube here taped in. The chin's been marked, the nose really didn't have a mark. But this is before we've done anything. A little bit of fullness here, a little bit of recession, and the next photo shows a little bit of liposuction in the chin region and the chin implant in place. A thing to note, her chin is very swollen. There's local injected, there's other fluid in, so it looks a little full and bulky, and that's normal. Her nose has also been injected, so there's a little fullness in the region. But the main difference, I just wanted to kind of show you the before and after. Notice her nose stays the same place of the chin. So there's a little bit improvement in the profile, better contour and shaping underneath the chin region. So this next photo is showing after we've completed the rhinoplasty. So the rhinoplasty has been done, the dorsal bump has been removed, of course the chin is already done and dressed, and I'll go back to her pre-op photo. You can kind of see hump present, and then after, nice contour, nice shape and appearance of the nose, chin implant in place, along with the liposuction. I'm going to show you a little bit of the intraoperative process. It's a little sensitive, so if you don't like seeing things like that, you may want to skip ahead a couple of minutes. But the shot you're seeing now is the nose already open. You can see the incision across the bridge of the nose. What I'm getting ready to do are cut the bones to allow for adjustment of the nose for better overall shape and contour. So what I'm doing here is I'm entering the little osteotome through the skin. It's going to go right up against the bone. And then once it's in place and I have it verified, we have a little mallet that you'll see come into the picture in a minute. And that little mallet is going to gently tap the bones. And once it taps the area, it's going to make a tiny little cut. And then I'm going to adjust the osteotome up and down until the bones have been cut enough that they easily adjust with just manual pressure with my fingers. So that's this process. This process is done pretty much right at the end. So in this photo, all the tip work's been done, the dorsum has already been taken down, all those things are ready to go, and the last thing we have to do is just adjust the width of the nasal bones to allow everything to line back up. And that's what this is showing here. So a little bit of tapping, a little bit of an adjustment, and in a minute I'll remove the osteotome, and you'll see me kind of press on the side of the bones, and that just lets me see if they're mobile and free enough that I can complete the process. I'm actually going to show you some videos of how she did during her first week of surgery. The typical plan is we will do the operation, the first week goes by, we'll see her back at a week to take off the splint, take out the packing, and I'll show you now that process and how it went for her.
It is currently around 4 p.m., the evening after my surgery. My surgery was this morning around 7 a.m. As you can see, I am a bit more bruised now around my eyes. The bridge of my nose and my eyelids are starting to bruise, but it looks worse than it feels. I really don't have any pain at all on the top half of my face, like none at all. I have not taken a pain pill yet since getting home. I'm going to take one shortly, but it does not hurt on like my nose or my eyes. I did change out this little gauze pad earlier. Just had some drainage when I got up and walked around my apartment to, just maintain like good circulation and everything, since I'll be sitting and lying down a lot for the next few days. The feeling in my upper lip has come back fully at this point. My neck does not hurt from the lipo. My chin, honestly, is the only thing that hurts. And of course, as you can see, it's very swollen right now, which is normal. On a scale of 1 to 3, pain-wise, I'd put myself at a 3, which is what I told the nurse, Alethea, before I left earlier. And yeah, I'm really surprised that I'm not in more pain. The worst pain, honestly, is the fact that I have a sore throat because I have to breathe with my mouth open. That's it. Like, my nose does not hurt at all. The chin pain is more annoying than anything. Like, it's not pain that's gonna make you cry or make me cry or anything. It's just annoying. It is the morning after my surgery. My eyes are really not as bruised as I thought they would be at all. You can see I do need to change my drip pad. My chin is still incredibly swollen. It's a little bit bigger than it was yesterday, and I have bruising. On a scale of 1 to 10 pain-wise, I'd say I'm about a 3. My chin is just really uncomfortable, but my nose does not hurt at all. I woke up with a really sore throat just from breathing through my mouth, but that went away as soon as I started to eat and drink. So I'll do another update later today. So it is the second night after my surgery. I had my surgery yesterday morning. As you could tell, I sound really congested. My bruising actually hasn't gotten that much worse on my eyes. On my chin, I've definitely got more bruising than I did earlier, and I'm super swollen on both sides. I have no pain at all still in my nose. It doesn't hurt at all. I have been experiencing a lot more drainage than yesterday, which is normal. As you can see, my mouth doesn't quite open that much right now just from all of the swelling. But overall, like 1 to 10, I would put my discomfort at a 2. I look way worse than I feel. It's Thursday night. I'm getting ready to go to sleep. I had minimal drainage from my nose today. No pain at all in my nose. Under my eyes, the bruising is spreading a little bit, but it really doesn't hurt. I clearly have a lot of swelling in my chin. That's where most of my discomfort is coming from. You can see the bruising on my chin. I'd still put my pain and discomfort on a scale of 1 to 10 at probably a 3. Other than just having kind of like a dry mouth from, sleeping with my mouth open and breathing through my mouth, the only other discomfort really is just the tightness, like that feeling in my chin. I did feel kind of nauseated today, but the medication really helped with that. So again, I would still say that it looks worse bruising wise than I actually feel. I don't really have any pain at all in my nose. It is Saturday, August 8th. I was feeling pretty nauseated yesterday, so I didn't really do an update video. For today's update, I would put my pain and discomfort between 1 and 10 at a 3 as usual. I was feeling pretty nauseated yesterday as well as this morning, but the medication has really been helping with that. The bruising under my eyes is turning like a dark yellowish green, and you could see I have more bruising on my chin. The swelling on my left side has gone down more than the right. I did have some drainage from my nose last night as well as this morning, so I've just been keeping it clean, changing out the little gauze head here, and just relaxing, trying to get up and walk around my home every few hours and staying hydrated and just taking it easy, making sure to take my medication. But yeah, I feel like I still look worse than I feel. My nose really has no pain. My chin is just uncomfortable because of the swelling. Today is Monday, August 10th. I forgot to film a little update video yesterday, but today I am feeling great. I had a lot of clear drainage yesterday, which just went on for a few hours, so I was changing this pretty frequently. But today I've had minimal drainage. I'm heading to my post-op appointment soon, so the next update that you see, this should all be off.
Okay, so these are her photos, the before and afters. The key thing to note is that these photos were taken about 4 months after surgery, so she's still pretty swollen. The big parts have been changed as far as the dorsal bump, the projection in the chin, but everything is still a little puffy. It can take, and typically does take, up to a full year for all of the swelling to go down. But I'll kind of show you those little differences here. So again, this is her front profile view before and her front profile view after. So again, bones are still roughly in the same place. You don't really have the projection, but you can see she is a little more puffy in the nose region. See how shiny her skin snaps back here and how you can see the definition of the bones? And then here, it's just a little less defined due to that small amount of swelling. Even in saying that, this is her side profile. You can see the bump has been reduced, the profile of the chin more prominent. You can see a little bit better in the side profile. Dorsal bump, minimal projection, and then after, better projection of the chin and a nice straight contour to the nose. So kind of going back and forth between those, you can kind of see the difference in the chin projection and of course the bump itself. And again, the main thing to note is that everything still has a little bit of a layer of swelling over it, so it's only going to get more refined and you'll see a little bit more detail as time goes on. Again, showing the side profile, old hump projection after, nice straight contour, more prominent chin, old hump, decreased projection of the chin after, nice straight smooth contour, and of course the chin, you can see the increase in projection. So again, just kind of showing a before and after side by side. Really the side profiles are the ones that you can kind of see the difference in the chin projection and the reduction of the nasal bump. Okay, so in part, everyone is different with this process. You know, where you start and depending on what you want as your final result will ultimately dictate the plan. This is just kind of showing one patient's experience with her results thus far. What I'll do is I'll post probably a follow-up video in 3 months or so, once the swelling comes down even more, so you can really see her final result. All right, thanks.